I'm very excited also to share that we have what we call the high-risk bariatric surgery program. High risk are patients who suffer from significant medical problems that in the usual practice surgeons would be hesitant to operate on. High-risk bariatric program was an idea that started about a few years ago in my mind. And the reason why it started is I said to myself, well, if we are not going to operate on really, really sick patients who actually need weight loss surgery to survive, to continue living, so who will? With that, I started putting the program together and putting all the pieces of the team together. And since then, we have performed procedures on patients who have had liver transplant, kidney transplant, awaiting liver or kidney transplant, patients who are on the heart transplant list or awaiting heart transplant. There are only 2 or 3 practices probably in the country that would operate on a patient who is on the list for heart transplant. We have performed a number of these procedures on patients who are actually surviving using an artificial heart and waiting for a heart to be transplanted in them. These, as you can imagine, are very, very high-risk patients. Require so much skill and technique to perform the operation in a timely manner, and also require a whole team that works behind the scenes to ensure the patient's safety. Patients who had multiple abdominal operations, where laparoscopic surgery becomes very, very difficult and technically demanding. Patients who have been turned down by many surgeons because of their high-risk abdomen, or what we call a hostile abdomen, when they've had many open procedures and so much adhesions in place. Patients who basically had no hope of having an operation. They would come to us and we would be able to help them, either endoscopically or laparoscopically or both.